Hello everyone, this is Harry Koster. I am a physical therapist and I'm the owner of Spine and Rehab Specialist. This is our Sunday Stroll number 6. So we've had 5 of these. If you've missed any of them, please refer back to either Facebook or our YouTube channel so you can watch the previous 5 episodes. What we're doing in these Sunday Strolls is we're talking about just a subject that's interesting, maybe in the physical therapy field, at Spine and Rehab Specialist, or just generally for El Paso. And really just want to casually inform you about some subject. So we try to keep them interesting and maybe from time to time even a little funny. So we're doing these in different settings in El Paso. I know the first couple of them have been pretty close to our clinics, but I figured today that we'll go for a nice little stroll. So where we're at today is actually in Franklin Mountain State Park. It's one of the largest state parks that's completely within the city limits. Yes, we are in the city limits of El Paso. So it's pretty nice, isn't it? It's actually also my backyard. I live not too far away from here, and I can just walk out of my backyard and go for a little stroll in the Franklin Mountains. So reason why I wanted to be here today, going for a little hike, a little stroll, is because last week Anthony talked about the effects of COVID-19 on movement, right? Because what's happening, most of us are sitting at home more, working from home maybe, we're not going to the gym, we're not being as active. And what we see is starting to happen is people start having problems with their movement system. They're starting to have aches and pains, tightness in their joints, tightness in their muscles. They're getting generally out of shape. I even last week had somebody who was complaining of balance problems that she thought were brought on by COVID-19. So I am definitely taking Anthony's advice to heart, and I'm going for a little hike in the mountains. So what am I going to talk about today? Well, guess what? I'm going to talk about physical therapy. Of course, you're going to say you're going to talk about physical therapy because I'm a physical therapist. But today is actually the first weekend in October, and October is National Physical Therapy Month. Every year, the month of October, we celebrate the profession of physical therapy. I've been in this profession for a very, very long time, more than 30 years now. And I still enjoy everything that it means to me to be a physical therapist. So what we do in physical therapy, you can sum it up in just a bunch of different activities. I mean, we have, heat and stim and ice and ultrasound, all of that. But that's really not, to me, what physical therapy is about. To me, physical therapy is about helping people move. We really see ourselves as movement experts, the movement experts. So for anybody that has problems with their movement system, again, the achy joints, the sore muscles, the tight muscles, the weak muscles, balance problems, all of those kind of things, really, we are the experts. So if you have problems with that, whether it's from COVID-19 or from something else, come see us, because really that is what we do. Now, as a physical therapist, I've always enjoyed working with just about any patient I ever see. Maybe there's been a few exceptions, but 99% of people I really love working with. And it doesn't really matter to me whether that's somebody who is very young, very old, very active, not so active. It doesn't really matter. I like helping them to move better, move pain-free, get stronger, have better balance, and ultimately really go back to the activities that they need to do or want to do, the things that they love. So that's really what physical therapy is about. All the other things are just, tools that we have. Now, being in the field for such a long time, I've seen certain things change a lot in physical therapy, and certain things actually really stay the same. My main tools that I use, in physical therapy are these 2 things here, my hands, and then to a certain point also my brain. Yes, there's other tools that have, maybe come along. Like in the clinic, we have an Alter-G anti-gravity treadmill. Really fancy equipment that helps you unload your joints. It was originally designed for the astronauts when they were dealing with gravity changes from going here to outer space. We use it, that same technology for our patients that may have pain in their knees, ankles, hips, and all of that. And that's great. We absolutely use that. We also have a pool, and actually I've done pool therapy way back, more than 30 years ago. And that hasn't changed a whole lot because water is still the same. The only different thing is we now have an underwater treadmill with cameras in it. Awesome. We can now do our balance testing, computerized with our Biodex system. Great. we have now musculoskeletal ultrasound, that we can use to really identify what the problem is with maybe your tendons or your ligaments, your bursas and everything else. So great, awesome. Ultimately, we go back to the tools that we use is our hands and our brains to really work, make people move better. We do a lot of manual therapy, a lot of hands-on stuff, stretching patients, and then we go into exercises, and yes, there may be some new exercises, but in general, exercises don't really change a whole lot. We keep exercising our patients. And that's how we've been able to help, people from all different activities levels, ages, and everything. And I really get just as much joy out of helping the older gentleman who, wants to be able to transfer independently out of his wheelchair, so that way his wife doesn't hurt her back. Just as much as the NFL player, who wants to, score touchdowns, on national TV. I like them all. And that's really what I've taken back out of the profession of physical therapy for all these years, helping people, making friendships, there's people that come back to see me, 15, 20 years later, because they remember how I was able to help them. And that really is something that has made the profession of physical therapy such an important part, of my life. So my, question or my request to you is if you have any kind of back pain, knee pain, shoulder pain, anything, any part of your movement system that is not working right anymore, come see us. One of the big advantages now is we have direct access for physical therapy, which means you can come see us directly. You can just pick up the phone and call us and say, hey, I want you to take a look at my aching back or my sore knee, or maybe, hey, my balance isn't what it used to be. See if you can help me or not. We can set you up for a free consult or an initial evaluation and help you. Prime example was a patient that I had last week. He hurt himself on Sunday. On Monday, he was on my schedule, and by Wednesday he was almost completely better. That is really what we're trying to do. Get people better, moving better, without pain or with less pain, and get them back on their way without the use of medication, injections, expensive diagnostic testing, or ultimately surgery. So, if you're suffering from any kind of musculoskeletal pain, or any, difficulty with your movement system, give us a call or, contact us through our social media. The phone number is 562-8525, of course, in El Paso, or 855-6466. Give us a call, give us a shout out, like this video if you like it. We'll see you next week for the next Sunday Stroll.